this video, we are talking about high-functioning anxiety. Even if you're doing pretty well in your day-to-day life, you might be doing really well at work or in your business, and you might have great friends and great relationships and a nice home, you still might feel anxious or overwhelmed or worried or have a general sense that things aren't quite right. If that's the case, it could be a sign of high-functioning anxiety. If you want to learn how to optimize your mental health in order to optimize your functioning in life, then go ahead and subscribe to this channel. I'm Dr. Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. And I'm the founder of Pacific Integrative Psychiatry, an online mental health practice serving professionals across California. Before we jump into the video, I'd like to invite you to grab my free holistic mini course, which is all about ways to overcome anxiety and sleep using natural methods. So you can go ahead and grab the course using the link above. You can go to our website, pacificintegrativepsych.com/mini course. The link is also in the video description below. There are lots of different kinds of anxiety disorders, like generalized anxiety disorder, obsessive compulsive disorder, social anxiety disorder, and so forth. So high-functioning anxiety isn't an official diagnosis per se, but it describes anxiety in people who are pretty high-functioning, you're doing pretty well in your day-to-day life, but the symptoms of anxiety can really have a significant impact on your everyday existence. And it can be hard to recognize because the symptoms are pretty subtle because, as the name says, people are pretty high-functioning, so it seems like you're doing pretty well overall. But there are a few things to look out for. So here are some signs. The typical picture of somebody who has high-functioning anxiety is that they excelled at work or at school. You're typically described as an overachiever. You might even show up early to work or show up early for classes and take on extra responsibilities. You're organized and you're a planner, and people know that they can rely on you. People generally see you as really helpful and maybe even pretty calm. They think of you as detail-oriented and hardworking. And you're the type of person where people would never guess that you have anxiety. But here's the thing, you have a hard time setting boundaries. It's hard to say no, and you might find yourself falling into patterns of people-pleasing. And then what happens with people-pleasing is you get overwhelmed, and then you start to feel resentful. You might be worried about letting other people down, or you might be really worried about saying the wrong thing, which then leads to seeking reassurance and validation from external sources. Here's a big one. You don't like to ask for help. People who have high-functioning anxiety have a hard time relaxing because it feels like you always need to be busy. You also always need to be productive, and it's hard to even know what to do with yourself if you have downtime. You might even feel guilty when there's white space in your calendar, so you have a tendency to try to fill up all that space with different kinds of activities. And a big part of high-functioning anxiety is that your mind is constantly active. You might find yourself ruminating, you're overthinking, you're planning, you're thinking about the future, and you're always thinking about what could go wrong, and you have a tendency to be highly self-critical. And the thing is that most of us are our own worst critics. Part of this overthinking might also involve comparison. You might find that you're constantly comparing yourself to others, what others are doing, what they might be thinking of you, and how you measure up. And this constant ruminating and planning and overthinking and worrying about the future is exhausting, so you might feel tired a lot of the time. Does any of this sound familiar to you? If information like this is helpful for you, then go ahead and click the like button. Because my practice is based in the San Francisco Bay Area, even though we see people all over California, we work with a lot of people from the tech world and the business world, so we see a lot of high-functioning anxiety in our practice. And it can show up as all the features that I just listed out. In addition to problems with sleep, feeling irritable is another big sign of high-functioning anxiety. You might find that you're just always a little bit on edge, or even have a prone to be a bit snappy with your partner or your loved ones. It might show up as physical symptoms like tightness in your jaw. You might find yourself clenching, tightness in your neck and shoulders, or just kind of general aches and pains. And then people might turn to substances to cope, so you might find that you turn to a glass of wine or a cocktail at the end of the day, or even cannabis to help kind of relax your system. So the good news is that there are lots of ways, healthy ways, that you can deal with this pattern of high-functioning anxiety. And the key piece is to figure out what works for you. And this is something that we work with people on in our practice, to figure out what a personalized, effective routine is going to look like for you because everybody's different. So the first thing is to make a commitment to your emotional fitness. It's just like physical fitness. You have to work on it and be proactive to make improvements. Also pay attention to your lifestyle. So just take note of how your sleep patterns affect how you feel and the tendency towards anxiety. Also notice how alcohol or caffeine or other substances might affect you as well. Even certain foods can have an impact on mood, so that's another thing to pay attention to. Meditation, as many of us have heard, does help to reduce anxiety and stress because it actually creates measurable changes in the brain that affect how we go through life. Meditation is just a great way to create a little bit of space from your experience and your reaction to those experiences. Then you can always talk to a professional like myself. You can talk to a therapist or a psychiatrist for more guidance on how to navigate issues with high-functioning anxiety. And then certain types of therapy like CBT or cognitive behavioral therapy can be really helpful. So what helps you with high-functioning anxiety? Go ahead and let us know in the comments.